Centers for Medicare and Medicaid Services, Healthcare Fraud Prevention Partnership. Kimberly Brandt, Principal Deputy Administrator for Operations, Centers for Medicare and Medicaid Services.
As Principal Deputy Administrator for Operations at the Centers for Medicare and Medicaid Services, my job is to protect our nation's patients and healthcare dollars. This is why the Healthcare Fraud Prevention Partnership, or HFPP, is so important. It brings the public and private sectors together to combat fraudulent and wasteful spending. The partnership is quickly approaching 100 members and includes more than 73% of covered American lives, all connected by one goal: sharing data to prevent fraud, waste, and abuse in our healthcare system.
Catherine Leff, Director, Special Investigations Unit, CareSource, Ohio.
Fraud is a big deal in the healthcare space.
Gary L. Cantrell, Deputy Inspector General for Investigations, Office of Inspector General, Department of Health and Human Services.
What we know is that it's not just a problem that exists in Medicare and Medicaid. Those are the programs that we oversee, but this is a problem that affects the private sector as well.
Bruce Lim, Deputy Director, California Department of Healthcare Service Audits and Investigations.
And what we consider a top priority is really addressing the unscrupulous behavior and activity in the program that is leading to patient harm.
Louis Sicocchio, Chief Executive Officer, National Healthcare Anti-Fraud Association.
When you look at the problem, we estimate that fraud is in the tens of billions of dollars, easily.
The Healthcare Fraud Prevention Partnership has been a critical tool in terms of communication and sharing of trends in this kind of national fight against healthcare fraud.
Krista Jewsbury, Director, Special Investigations Unit, Humana.
The biggest thing we've gained from being part of the HFPP is just access to information that we wouldn't otherwise have access to.
The ability to look at not just my claim data, but claim data, across multiple plans, CMS and Medicaid, allows us to find those big schemes that we can't necessarily find on our own.
And by sharing this information, we're able to get ahead of some of these fraud schemes, but we also share best practices.
So how do we do it? The partnership supports state-of-the-art analysis of healthcare data that leads us to a deeper understanding of fraudulent and wasteful schemes, and ultimately to increase detection and prevention.
The Healthcare Fraud Prevention Partnership takes anti-fraud information sharing to the next level by pooling actual claims data from both the private and public sides.
It's maintained by a trusted third party so that we have confidence in the storage and maintenance of that data and the analytics that will be performed against it.
What this is going to be able to offer me and my team is really a clear picture, greater clarity in terms of the areas of risk within not only my program, but the risk that touches my program but crosses state lines.
So now we're seeing more complex studies that give us even more robust results.
HFPP alerts us to emerging trends, and we share information about how to combat these issues.
The more members we can enroll in this partnership, the bigger impact we'll have on fraud, waste, and abuse nationwide.
I would encourage any private plan or state agency or other federal or state program who's interested in fighting healthcare fraud to join the membership.
It's a critical tool in the fight against healthcare fraud, and a critical initiative.
What the HFPP is going to get in California is a very mature organization with proven success.
I think the best thing about the HFPP is the networking and the relationships that you build with the other participants.
The relationships that you will build through the HFPP are critical to being informed about schemes that are happening across multiple payers.
Most importantly, how can you make a difference? The simple answer is that the larger the partnership, the more lives we will protect and the more healthcare dollars we will save. So please join us. To learn how your organization can join the fight, go to hfpp.cms.gov.